Determining the best way to provide health care is an ongoing debate where most of the focus is on doctors, insurance companies, and the price of medications. Some, however, are concerned there's a looming shortage of nurses, starting at the education level. A hands-on career like nursing requires clinical training with patients overseen by a nurse with a master's in science. But nurse educators at the graduate level are a mature and aging group, and as they retire, it leaves fewer and fewer people to teach the next crop of caretakers.
It's a crisis.
That may sound over the top and dramatic, but for Mary Pat Lewis, Dean of the School of Nursing at SUNY Delhi, a nursing shortage is a very real concern, and it starts with educators.
From an academic perspective, all of our faculty have to be prepared at the master's level. So it can't be an individual who has practiced at a high level for many years, and we recruit them as faculty. Although we value that and we value their expertise, the issue is with accreditation. There are certain credential requirements that we have to have, and we have to show evidence.
Most colleges require their professors to have at least a master's degree, but in nursing, academia is competing with the almighty dollar.
Nurses can seek compensation at a much higher level in practice at a graduate level preparation than they can as a nurse educator.
And to nursing school deans like Lewis, that's where the crisis starts. With a master's in science for nursing, Lewis says graduates are at the top of their earning power, averaging about $90,000 in practice. That's often tens of thousands over the earning power of a nurse educator, especially one at a small rural SUNY like Delhi.
Certainly in education, the money is not the draw. The education itself is the draw, and the value to the profession is the draw, and the value to your own personal goals and gains. Your gains are being able to be flexible out in the nursing field and environment. There are different places you can work.
Melissa Ackerley is halfway through her studies to earn her master's in nursing, and she plans to teach. But that's after nearly 30 years of clinical work in the field. To become a registered nurse, you have to have an associate's degree, which SUNY Delhi offers. If students choose to do so, they can continue on to earn a bachelor's at the school as well. The problem arises at the master's level. 1/3 of all nurses are at least 50 years old, and with a graduate degree, they can work as an administrator or a nurse practitioner, providing basic health care as well as diagnosis and treatment of chronic or acute conditions. So that's where most people choose to go, leaving a smaller and aging population as professors. As they retire with no one to replace them, it creates a bottleneck of too many undergrad students and not enough grad-level educators. To help correct this problem, Assemblywoman Aileen Gunther has introduced the New York State Nursing Shortage Correction Act.
By 2020, the United States will have 193,000 nurses that are needed. Right now, that's what they think the shortage looks like. That's a lot of nurses.
It aims to create recruitment, incentive, and retention initiatives to help make sure there will always be enough accredited nurse educators.
We have to put more money into the nursing field. And you know what? More people have to stand up and support nurses throughout New York State.
Gunther, a registered nurse herself, has introduced several bills aimed at supporting nurses, including the Safe Staffing Quality Care Act that would require hospitals to beef up their nursing staff numbers for better patient-to-caretaker ratios. Some healthcare providers, like Albany Medical Centers, say they're aware of the potential shortage and have built that into their staffing management.
We don't have opportunities where I'm very concerned that, the entire department's getting ready to retire. There might be a group of people that came together and are working together and, 40, 45 years later are ready to move on together to retirement. And we track that so that we anticipate making sure that we're hiring in and anticipating those changes going forward.
Roche says, with a shortage in educators, a 2-year degree can take as many as 3 or 4 years to complete, as students wait for an opening in clinical rotations.
So I've done my classroom, but I'm literally in a lottery to get those rotations because of the number of master's prepared or doctoral prepared clinicians that can be my faculty instructor, and the sites to be able to do that at the bedside. You can only saturate clinical areas so much with students.
Albany Medical Center is not a teaching hospital, so staff nurses interested in furthering their education are often referred to nearby schools that offer a master's in science. As a result, Roche says the hospital often looks to hire graduate nursing students from those schools. Still, even at a small school like SUNY Delhi, Dean Mary Pat Lewis says something needs to be done to entice more nurses with a master's in science to choose education.
The goal for nursing is to add to the body of science of nursing. How to be nurse scholars, how to do research, how to add to that body of literature. How do they function as an advanced practice nurse in a setting that recognizes all of the changes in health policy? How do they be a leader? How do they be a manager? And then once they get to the top courses of the program, what's the role of the nurse educator?
To help give them a better edge, Lewis says all of the graduate level nursing faculty are remote. They're recruited from all over the country and teach via WebConnect. They're not required to live in Delhi and can practice at a private facility while they teach. In addition to retiring nurse educators, a significant number of practicing nurses are also expected to age out of the workforce. Between retirements and staffing cutbacks, by 2030, the American Journal of Medical Quality warns the country could have a shortage of nearly 1 million nurses, and New York State could face a gap of nearly 40,000 needed nurses. Now, let's send it back over to Matt at the desk.